Welcome back, everybody.
Welcome back, everybody.
Thank you for joining us. Nick, why don't you get us kicked off by letting everybody know who our guests were?
So our first guest was Heike Daldrup-Link. She's a professor at Stanford University in the radiology department, and she's a pediatric radiologist. Before Stanford, she was also a professor at UCSF. And our other guest is Virginia Hinostroza, and she is a life science research professional in the radiology department at Stanford as well. And she obtained her Master's of Science in Bioengineering from UCSF. Bioimaging.
Keep you honest. Yeah, and they both have really extensive backgrounds in both radiology, obviously, because that's kind of their specialty and how they linked up. But our conversation is a little different. We actually end up talking a lot about diversity in medicine and diversity within radiology, and it was a fascinating conversation.
It was. There's I think a lot to take away here, and I think this is a topic that is starting to be discussed a bit more, but there is much more that we can do with this. So we hope you enjoy this episode. Thanks for tuning in. Sit back, relax,
and enjoy the show.
So thank you both for joining us today. We really appreciate it. And we're excited about this conversation because I think it's a topic that we haven't really discussed too much thus far. And it's something that is definitely present with like our podcast, especially like talking with a lot of different professors, working in a lot of different institutions. So yeah, if you just wanted to get started by sharing a little bit about yourselves, some of the work that you do, and then how maybe you got into this topic of diversity in medicine and why it's so important.
Okay, yeah. So thank you. It's a great pleasure to be here. And my name is Heike Daldrup-Link. The first name is Heike. That's sort of like a northern German version of Heidi. And I'm from the north of Germany, from a university town, with the name is Münster in Germany. And I grew up there. I went to medical school there. And later I actually moved to Munich, which many of you may know a little better. That's in the south of Germany. And there I did a radiology residency and also a fellowship in pediatric radiology. Sometimes after that, I came to San Francisco, to the University of California in San Francisco. And initially, I started a postdoctoral fellowship there. And later, I accepted a first position as a junior faculty at UCSF. And I have been at UCSF for almost 7 years as a pediatric radiologist. And then from there, I was recruited to Stanford in 2010. And I'm now a professor in the Department of Radiology and by courtesy in the Department of Pediatrics at Stanford. I'm the director of the Pediatric Molecular Imaging Program. I'm the co-director of the Cancer Imaging Program at the Stanford Cancer Center. And I'm also the associate chair for diversity in the radiology department. And I think that's all in a nutshell.
Thank you.
My name is Virginia Hinostroza. My last name is Peruvian origin, so Virginia is just fine. I actually had a very roundabout, long route to where I am right now. I'm a research staff at Stanford in the cardiovascular imaging department. But I actually started off as a history major. And soon after I got my history degree, I moved to Memphis, Tennessee. And my time in Memphis, Tennessee was actually incredibly educational and very formative and has informed a lot of my interest and awareness in diversity issues. I grew up in the Bay Area, which is very, we're very fortunate, very diverse, very welcoming. And so when I moved to Tennessee, it was definitely a culture shock because it's very different. It's not just fewer palm trees and more magnolias, which is what I thought. So while I was here, I was really lucky to start working at St. Jude Children's Research Hospital, which is based here. And I started on the fundraising side. And I took phone calls took donations over the phone. And so I had to be ready to answer any question a donor might have. So I got to learn about everything the hospital did, from the patient care to the cancers that were being studied, to also their community outreach, both on a local level and the global level. And it's an amazing institution, and it continues to inspire me, even though I'm not there. So after a couple of years, I actually moved back to the Bay Area and kind of randomly ended up in radiology. It was just because I knew my boss, basically. And then I ended up going to UCSF to get a master's in biomedical imaging because I wanted to understand the technology on a much broader level. And then last year, I joined the diversity committee as a co-chair of the trainee side, so the residents, the fellows, staff. And so I've been in that position for about a year, and it's been super informative. And I think, like a lot of people, last year, that's when I really got inspired to get involved and actually take initiative and get involved in activities that are going on, as opposed to just reading about it and being informed about it. So I'm really excited about all the work that we're doing and all the conversations that have definitely popped up over the last year, which were definitely not happening even 2 or 3 years ago.
Yeah, that's so cool. Thank you both for sharing your backgrounds. I was going to ask too, if maybe we could go into, from each of your perspectives, I'd love to know how you two came together on this work. And then maybe in part of your answer, we can answer what is diversity in medicine for people listening? And then maybe what's diversity in medicine in radiology and how that's relevant too. So Heike, we'll start with you first again, and then we'll work back to you, Virginia.
Mm-hmm. I must say, I don't exactly remember when I met Virginia the first time. I think if I think spontaneously, I believe initially I got to know her through her excellent research work in our 3D lab. And then sort of a little later, I got to know her interest in diversity. And I think at some point we talked at one of our diversity events, which at the time were still in person. So there were more opportunities to chat. And I don't exactly remember how you came to the trainee diversity committee, Virginia. Maybe you can remember that one.
Sure. So Heike has been heading the diversity newsletter for a while. So I would always get her emails on a monthly basis. And then I would poke around at the diversity events, but not very much. And then last year, that's when there was an opening for the co-chair for the trainee side. So that's when I was super inspired. So then I wrote Heike an email. And so we've really been working virtually just this past year.
Mm-hmm. Cool.
And then I forgot the second part.
Yeah, the second two questions, and maybe one of each of you can tackle one of them, but it's maybe giving everybody a definition or a perspective on what diversity in medicine does and kind of what that mission maybe entails, and then how radiology specifically is trying to tackle this issue too.
Mm-hmm.
Heike, would you like to start?
Yeah, so I can start it from the maybe statistical point of view. So I think the US census data on racial and ethnic diversity currently shows that about 40% of our population makes up racial and ethnic minorities. And by 2050, we expect that more than 50% of our population will be what we now call racial and ethnic minorities. And if we compare that to the field of medicine or to the field of radiology, there's a major disparity there. Currently, in the field of medicine and specifically in radiology, I think racial and ethnic minorities are definitely less than 10%, and in many radiology departments, less than 5%. So they make up very, very few people. And this can lead to a number of consequences that we can talk about. It can affect the medical care. It can affect our creativity in research. It can affect our efficacy as teachers. And so we do believe that it's very important as a mission to make sure that we have a better representation of underrepresented people in our field in order to serve our community better as doctors, as physicians, as teachers, and as researchers.
I think Heike sums it up very well, but I can add a couple of things. So definitely, the medical system, they need to understand who they're servicing. So if you have a more diverse population, you need to be able to speak and meet them at their level, whether that's, language or socioeconomic level or racial, cultural. So I think that could be applied to medicine to the whole field. Radiology is a little bit unique in that it is a little bit more kind of behind the scenes. Radiologists have traditionally been in a reading room, just interpreting CTs and X-rays. But there is another field of interventional radiology, or like Heike, they're involved in radiation oncology. So there's a lot more interface with patients there. And then there's also, we work with a lot of engineers, computer scientists, chemists. It's a very broad field that encompasses a lot of professionals. But like Heike said, if that workforce isn't diverse, they're not going to understand the problems that the patients are having or how to best treat them. And also how to best implement. Like, we may have an amazing algorithm or an amazing treatment, but if you don't understand how that's going to play out on the patient level, whether it's a local clinic or even like a remote clinic, then we're not going to be effective caretakers of our patients.
Yeah, so thank you both for sharing that. Some of the definition and kind of the work that you're doing, or at least starting to do, especially, like, I know it's an ongoing process. But I something I appreciated about the text of the Diversity in Medicine that you authored was that it really talked not just about like the client facing effects of not having diversity in medicine, but also just the lack of opportunity for people to really rise up in a field that is very heavily dominated by one ethnicity. And I think hearing those stories from those different people was very fascinating and very eye-opening. And so I know that you spoke about the different types of consequences that range from like medical care to research. I was hoping to start kind of with medical care and how this kind of shows up in like real life situations and what we see as some of the setbacks of having a lack of diversity.
Mm-hmm. Yeah, I mean, one major factor is communication, of course. Different people from different backgrounds can have different ways to communicate. And we could miss important information from a patient if we only follow like one way of doing things or one mode of communication. And we could also have difficulties to get information across if we just have one way of doing things. So I think by diversifying our workforce, we can better serve our patients. I think maybe if I can think of an example, currently the situation that some communities are hesitant to get vaccinated could be a good example. If one group of people can think of ways to convince people to get vaccinated, however, none of these people are members of another community, they may entirely miss the point that leads people in that other community to be concerned about getting vaccinated. So this could be any community. It could be like a Hispanic community, a Black community, and then an entirely white community tries to convince people in that community to get vaccinated, and they entirely miss the point why these people are hesitant. And so if we had a more diverse workforce, we would better understand motivations or concerns of our patients and could better address them. I think maybe that would be one example. Another very often cited example is also different ways how patients express pain. That can be very culturally influenced. And so it is possible that if you have only one homogeneous group of people, that they only understand one way of pain expression, and they may oversee or discount the expression of pain from a different community. And that is a real problem. For example, it has been very often cited that when Black women express that they have pain, that they are often discounted. And so again, if we had a team of a very diverse team where the physician and the nurse and the radiology technician are all from different backgrounds, then we would have a higher chance to pick up on such clues, which may not be apparent to any single one of the team members. Mm-hmm.
Yeah, and one thing that just comes to mind when I'm hearing you talk about this whole issue is like the idea of like trusting your healthcare system, right? And I think something that I know that it's a little bit of a different piece of research, but they did some studying on when a person is prescribed a drug and whether or not they will follow through with the entire length versus when somebody from a vet is prescribed a drug for their pet, following through on the entire course of treatment through that prescription for their animal. And it's some very significant percentage of people will not follow through themselves, but will ensure their pet follows through. And man, I can only imagine how much more of a hurdle that is for somebody to like follow through with their healthcare and trust their healthcare system if they don't feel like they're being heard when they show up to get a piece of treatment, right? So it really adds to the importance, I feel like, of how much we really need a diverse healthcare system, because otherwise people very well may be missing out on the healthcare that they need.
Mm-hmm. I think maybe also something that people can relate to is if you imagine you travel to a different country and you break your leg there. And you are brought to a hospital where you have difficulties to understand the language. Everybody is from some different culture, and now you have to undergo a surgery. And I think many people would want to go back to their culture and be treated there. Mm. And I think that same concept can also be true in like your own environment. If you come into a system where everybody looks different than you, then you might not trust the system and might not follow through and might not really have the best results because you cannot communicate effectively.
Mm-hmm. I can add an anecdotal story to that. Yeah. So my dad passed away about 8 years ago. He had cancer. But he was in treatment for about a year before that. And he had lived here in the US for about 30 years before that. So he knew the system, didn't have perfect English, but could get along just fine. And I was working as an emergency room scribe at the time. So I acted as his advocate, basically kind of talk to the doctor, talk to the nurse, and so translate, make sure he understood everything, make sure he didn't miss an appointment. Everything was going like well. He was responding to treatment. But he really wanted to go to Peru. And my mom was like, I don't think you need to. His doctor wasn't completely happy with the idea, but he was really insistent. And so he went to Peru with, we made sure he had strict doctor's order, what to do, what not to do. And he didn't follow through with that. And actually, when he was in Peru, he went to what we would call a curandera, like a local cultural doctor. And that person told him that he was totally fine, that all the extra stuff was just doctors doing extra things that were unnecessary. So by the time he came back, he was not well. And then he didn't want to do chemo because he wanted to believe what they had told him in Peru. And it made all of us super nervous, but we were like, okay. And by the time he actually agreed to go back on chemo, it was too late and he had to go into hospice. And what I remember, this is my dad, like I know my dad. And my mom was like, when he finally told us why he didn't want chemo, why he rejected it, we were in complete shock. And so for me, that's when I really understood the power of culture. Like, here's my dad. He's done well in America. He knows the system. He trusts the system, or I thought he did. But yet what he heard from his culture overrode all of that. And so, if that happens with someone that I thought understood it, I can only imagine what it is when you don't understand this and when you don't trust and you can't communicate in the same language. And here in Memphis too, there's a lot of disparities, so economically, racially as well. And in a clinic that I worked in, there were a lot of patients whose parents weren't able to read. So there was a huge difference in education level. So just making sure that they understood the instructions before they left the clinic was super important, because there wasn't a guarantee that they were going to be able to understand that from reading the label. And so just being aware of these different things, can really affect patient care. When I think back of like, what would I have done differently with my dad? And I still don't quite know, because it's like, how tightly did he hold on to that belief? Even though we would explain everything to him, the science and all that thing. So I know that's happening out there. And I think that really highlights the necessity to make science and medicine more accessible to the everyday person, to the lay person out there. So it's not intimidating, so that they aren't afraid to ask questions.
Yeah. And something that your story has so much value in it, right? To teach, that we can learn from. Because the other thing I think about too is like, when we think about our practices in the United States of doctors working with patients, that just the power of cultural presence in each of our medical systems can have that impact for patients here too, right? So if we had somebody who was, of Peruvian descent from that your dad could have spoken to here, would that, I mean, it's a question, right? I don't necessarily know the answer, but it would be, it's clearly a powerful tool to get people opening up to like the opportunities of care that are in front of them.
Mm-hmm. Right. I also think, like, is there a way that you could combine that culture with medical language so that it would make sense? And that's something I don't have an answer for, but it's just, I think of how powerful culture is, that you can't ignore it when you're providing care.
Yeah. And also literally the language. So I also once had an encounter where a kid refused an exam, and the family happened to come from Germany. So they asked me to come over and just talk to the patient. The parents did speak English very well, so they understood what had to be done. That was not the point. Otherwise, they would have probably needed an interpreter. They just needed to convince the child to do the exam. And so I came and talked with everybody in German, and the kid did the exam. So I think that could similarly be the case for people who feel more comfortable speaking Spanish or any other language. If we had a diverse team and could help in this way, we might be able to deliver better care. Mm-hmm.
Yeah, I think that piece about accessibility and just like the dissemination of different types of information and knowledge is so important. Like in a lot of my work, it's growing, and you try to be as culturally humble as possible. But there still are those barriers to accessibility of like not having consent forms in different languages, or an interpreter is great, but still there's barriers to that still, right? So yeah, I think this is so important, and it's something that can't be neglected, because like in clinical work for therapy, we can't like really deny the fact that like when you work with a therapist who looks like you, there can be a general sense of possible comfortability rather than somebody who doesn't look like you. And that's a factor that definitely needs to be considered.
Mm-hmm. I also think just like the accessibility and the dissemination of like technology and treatments is also a big issue in medicine when you talk about diversity. Like in the Bay Area, we have UCSF and Stanford, and I think a lot of people have good healthcare, so they have access to these really great institutions. But if you go like to the middle of the country, there may only be like one hospital that is actually able to provide quality, top-notch imaging or a really specific treatment. So if you live, 5 hours away, getting treatment means taking a day off, having a family member take a day off, getting a hotel room, gas, a lot of other expenses that like we don't often think about. And so that's asking a lot. They have to, take out a lot from their lives, from family members, just to be compliant with the treatment. And so in a lot of those cases, I think it's understandable why they don't always follow, don't always go to every single appointment. From the research side, we're like, oh, lost to follow because they were just so far away. But if we could somehow disseminate these technologies, make imaging technology, diagnostic technology much more available, that could also affect how, people getting diagnosed earlier, getting more effective treatment earlier.
Yeah, that was actually a question I was going to ask. In the field of radiology, my understanding is a lot of the equipment is highly advanced and expensive. Mm-hmm. What is the, like you said, we live in a pretty technologically advanced microcosm here in the Bay Area. But when we look at nationally, are there severe shortages of the radiologic technology around the country, or is access to radiology, like good radiology, readily available? Obviously, there's going to be, I think of somebody out in Montana who may be an outlier, when they are pretty isolated, but that's like a rare exception, or not a rare exception. I don't want to say that, but those are areas where we would maybe expect a more limited availability. But how accessible is it?
Mm-hmm. Yeah, so there I can chime in a little bit. I serve as a central reviewer for the Children's Oncology Group, which is a group that coordinates medical treatments for children with cancer throughout the whole country. And they prescribe different treatment protocols, and then they do medical imaging before and after the treatment and see how the treatment is working. And they collect the medical images of these patients in a central registry, and then they ask radiologists, such as myself, to review all the images of a group of patients that got one treatment or the other. And so with that, we get to see imaging studies from like all over the country and from different hospitals. And there is a big difference of what kind of imaging, like what the quality of images that we get from different centers. We do know that as a group, of course, and we try to apply measurements for our tumors that can be applied to like a simple imaging setting and also to an advanced imaging setting. So I believe that we have adjusted to this to some degree. I'm not aware of any research or data that compare the outcome of a patient who, for example, throughout their whole medical journey, like only gets CT scans for a certain diagnosis, whereas another patient gets MRI scans, which might provide a little more detail. If that affects ultimately the outcome, I do not know if there are studies out there. Maybe there are, and what they show. Mm-hmm.
It's very interesting. I hadn't even thought of like the resource. I was asking about the machines, but like the people are like also a big resource that we're talking about. And it's the understanding of what is coming out of those machines that's equally, if not more important than that. And like right back to the important to have diversity in all across the field. So yeah, Virginia, you were going to say something.
Yeah, I actually don't really know the stats about here. I did listen to a talk from a Peruvian doctor, and he said in Peru, they really only have like 2 imaging centers that are reliable, that have enough, trained radiologists, but that a major challenge is protocols, having enough radiologists to be able to fine tune the machines to image cancer versus, lung issue or something. So training is also an issue. And then I think, Heike, please correct me if I'm wrong, but for a hospital to put in a MRI, it's about like $1 million or 1.5 million per.
The costs can be very, very, very variable because it's not only the machine, you also need to design the room. You need to shield the room so that adjacent computers are not affected and so on. So that's a complex question, which I'm not sure we can answer.
Yeah. So there's a whole infrastructure, the hardware, the machine, but also like the support, the technical support you need, technologists and physicists and IT people. It's a lot.
Yeah. So I'm curious about a bit of your experience, Virginia, working with this diversity committee and especially interfacing with trainees and residents, and kind of what some of the challenges come up and some of the work that you have been doing in that committee.
Well, I'm still fairly new, and I've the past year has definitely been a learning process, and I think it's been different because of COVID. Everything's been very virtual. But the biggest, so apart from everything just being virtual, which I think is itself a challenge, I don't know if it's really a challenge, but there is a lot of interest in having conversations about this. And over the past year, I think people are starting to get comfortable being uncomfortable. So in a lot of one of our radiologists spearheaded a diversity challenge where once a month we met in a Zoom meeting and we talked about a diversity topic, whether it was housing inequality or microaggressions. And we would all watch a small video or have some sort of a prompt, and then we'd break out into small groups. And I think in the beginning, there were a lot of people that were very cautious and guarded with what they say, which is totally understandable because I think, these are sensitive topics. But as the sessions went on, I think people were more understanding that, people like myself, people of color, understand that, we have to talk about these things and people aren't going to know exactly the right thing to say the first time. But if we don't create a safe space, we're not going to talk about these things at all. We're not going to make any progress. So I think a big motto that has come up a lot over this year is progress, not perfection. Apart from that, I think kind of just general challenges in diversity in radiology. Definitely, there have been times where I'm the only female in a room, the only female of color in a room. And there have been times where I'm the only American in the room, ironically. So I'm often the liaison between American culture and radiologists. I have a lot of colleagues from Europe and China. So that's been an interesting experience. And whenever I can't answer something, because I'm definitely a Bay Area person, I'll resort to my Memphis friends and be like, I don't get this, and consult with them. Can you explain why this is this way or not?
Yeah, I think this is something that Brennan and I have discussed several times, and I think I'm seeing even the wider applicability to this. But I was sharing with him once that this past year of work was really challenging with virtual meetings and everything else, just working from home and dealing with pandemic and racial injustice. So a lot of different layers. But I found that my group supervision, where I was able to collaborate with my cohort mates, was something that was extra special. And what was so comforting about it was just that shared experience of like being a student in a program. And I think just that layer was super helpful. And it allowed us the space to have a conversation about something that we probably wouldn't have just had a conversation about if we didn't have time for it. And I think that's what it sounds like. A lot of the work that you're doing provides that space to really, like you're saying, have those uncomfortable conversations that everyone's thinking about, but no one's saying. And then really bringing these problems to light and helping people feel a little more accepted, a little more comfortable in the space that they're in. And yeah, I don't think that can get understated, because even just that space to where we had shared experiences in my group soup, like it was so helpful for me during this time. And that was, yeah. And I know that was different, but still, I think it's so important.
Mm-hmm. I really have to credit Heike, because she started the diversity newsletter years ago, and that it's an open invitation to faculty and staff and anybody in the department to write about their experiences. And so she's been creating these spaces for a while. So definitely appreciate all the work that she's done. I'm still a newbie in this.
Well, yeah, Heike, I was just going to ask, I'd love to hear a little bit more about how the newsletter came to be, because like Virginia said, that wasn't something that was widely done, not every work, but now you see it all over the place. So you were kind of on the cutting edge of this. So what was it like getting it started, and how did it kind of take shape as you were starting to do more and more of it? And maybe what were some of the types of content that it would include when you would send out the newsletter?
Mm-hmm. Yeah, I think initially we had sort of like a discussion within our committee or our group that people felt they got a lot of communication from the top down, like this is the memo from the chair's office, and you need to do this and this and this, which of course is also important, but there was not really a pathway for the community or the group to share their experiences and their thoughts. And we didn't really have any formal way in sharing different experiences. And we found that would be important, because if the people in the leadership team are not aware of what is going on within their community, they cannot address any problems, right? So we thought about how we could channel this communication. And initially we thought, we start discussion groups. And that was helpful also within a small group. However, that only goes so far. If you have a discussion with your 6 people, that helps these 6 people, but not the broader community. In the radiology department, we have hundreds of members, so this is a very large group. And I was wondering how we can make a little bigger impact, and also how we can share ideas like on a little larger scale with people who are comfortable to do so. And that then led to the idea to create a newsletter, really as a grassroots initiative. People of the community, anybody, can share an experience regarding a specific topic. And we keep it absolutely authentic. I actually had to fight for that. There were then editors and all kinds of people who wanted to polish whatever people were creating. And I felt that it was very important to keep it as authentic as possible. It wasn't really so important to create the best grammar, but we rather wanted to hear it in the voice of the people. And so with that, we created these newsletters, which always discuss a certain topic. Anybody in the department is allowed or invited to participate. And we got some amazing stories through that. These newsletters are available on our Stanford Diversity website, so people can have a look at them if anybody is interested. Mm-hmm.
Yeah, I was just gonna applaud how cool that is that you guys were able to get that started, because when even just with what Nick and Virginia were just discussing a moment ago about, having these spaces where people feel not only safe to admit maybe where they've got a blind spot in the first place, but then a safe place where they can then be educated on that blind spot in a way that's really productive for everybody, is so important. And just the way that you fostered that, like that grassroots style of bringing that up, I think that's really cool.
Yeah. And I think also in a group setting, as Virginia alluded to, sometimes it can be difficult for an underrepresented minority member to speak up, right? If you are the only of your cohort in a program, then you might be reluctant to speak up. And I think it's a little easier if you write it down and then share your thoughts. With that, you have a little less of a barrier to share some insights. And for the newsletter, we also allowed like both like stories with the name of the author or anonymous story if somebody was not comfortable sharing their name. Mm-hmm.
Yeah, that was actually going to be something that I was going to ask of, like, initially getting it started. What was maybe the process like? Was there some hesitation for people to really come forward and share? Like, how was it that you were able to kind of develop a culture of trust within that process?
Initially, it was definitely so that people were reluctant. And I always started with sort of like an introduction where I shared some of my thoughts. So I thought I start, and then hopefully it resonates with some people. And initially, I reached out directly to people, such as to Virginia, and asked them if they would be interested to do so. I started within our diversity committee where we knew each other well. So I already had an established relationship with these people. And from there, I tried to like increase the radius and actually contact people who I did not know at all. And that was something that developed over time. And again, we initially got very few submissions, and then over time, this really took off, and people spontaneously contacted me that they were interested to submit something. Or we even had guest editors who offered to create an entire newsletter with a topic that they cared about deeply. For example, now in October, we will have a newsletter on disability in medicine. And so we have a very active group who works on this, and they want to create their own newsletter on this topic. Mm-hmm.
It's a very like welcoming newsletter too. Like some people will submit recipes that come from their culture, or it'll just be like a thank you note to their coworkers, or just share like a small moment. And then other people will write a whole essay about their PhD experience. And so there's a wide range of stories being submitted.
Mm-hmm. Yeah, and that's what I always say. We accept everything. We accept photos. We accept a poem. We got poems. It's really interesting. You get to know new skills of your coworkers that you were not aware of. So we had a very talented poet in our group. And some people who are hobby photographers who submitted their photos. And then, of course, people who share their stories. So I think, we got really a wonderful variety of submissions for these newsletters.
Mm-hmm. Yeah, that is awesome. And so I'm curious a little bit more about the effects on like the research side of things and what we kind of see there. Like, what are some of the pressing concerns, and I guess especially in radiology, kind of how does that show up?
Mm-hmm. Yeah, so if you would imagine that you have a group of 10 Einsteins and only 50% of them can realize their ideas, then maybe you can imagine what you potentially miss, right? So if we only allow a certain subset of people in our community to be creative and realize their maybe groundbreaking discoveries, we may miss out on a lot of great new innovation. And I think that is one important point on a single level. On a team level, I think that if we bring diverse people together, we can potentially achieve something that the single person would never be able to do. And I always compare that to an orchestra. So imagine you have just one flute or just one violin or just one trumpet, and then you multiply them. 10 trumpets cannot do the same as a whole symphony or like as a whole orchestra. Only the orchestra can play a symphony, but 10 trumpets cannot. So I think there's some value in diverse teams who bring different ideas to the table. I think these are like my initial thoughts on this.
Yeah, I can add on to that. So definitely kind of like what Heike was saying, if you're missing out on half the researchers out there, the focus of the research is going to be very, very different. So a question that I'm very interested in exploring is, how do we end up studying what we're studying? And that's a complicated question because it ultimately depends on who the researcher is and their own specific interests, but also where the funding comes from. Because if you can't find the funding, whether it's from the NIH or the CDC, or if it's from industry, that is going to direct what research gets done and what doesn't get done. And more generally, also just how up until recently, whenever you're studying a big group of people, a lot of times they're just lumped together as like people, as opposed to really breaking down like this percentage are men and these are the different findings versus these percentage are women. And there might be some differences too. A lot of times there aren't differences, but I think it's more and more interesting to see that there are differences and people are recognizing that, women age 50 and older, 60 and older have different biochemistries than men do. And so that's going to affect diseases too. And if we don't really kind of get into the nuance of that, we are overlooking a lot of findings. And I know just my research group focuses on the aorta, which is the big vessel that comes from the heart. And I'm 5 feet tall. And then one of the attending in our groups is 6'4" or something. And there is no way like our baseline measurements are going to be the same, but we still don't have like a good way to measure an individual baseline. So it's just questions like that I think we're just starting to kind of be a little bit more open to. I think there is more openness to looking at different racial breakdowns within diseases. Some of that has been pretty well studied, like diabetes and the African American community, or like in the Native American community. But I think we're missing a lot of that we're just starting to get into. But finding enough numbers is always a challenge in those studies.
Yeah, I can add to that with regards to government grants from the National Institutes of Health. We actually have to make a statement whether we consider different demographic variables in our research. And we always have to compare male and female data as a starter. And we always have to make a breakdown for our research that explains like that different demographics are involved in our research. So for government research grants, this has been recognized and is also tracked. Again, I don't know then like who analyzes the aggregate data, but the data would be there to do meta-analysis of all this research, of all researchers who are involved in government-funded research. Mm-hmm.
I was also just going to mention kind of on a broader scale too, like there is a disparity in where the research is being done. Mm-hmm. In the US, we're very fortunate to have a lot of resources for that. Same with Europe and to an extent Asia, but that's not really always the case like in Africa or Latin America. And so in those populations, you have different racial ethnicities, different diseases, and there's a lot we don't know too.
Yeah. Definitely also on the cancer side, we know that certain cancers are more common in certain demographic groups, and that can, like discovering these relationships can help us to generate approaches for early diagnosis so that we can detect cancer early and then treat it successfully. So that's where this research is really important and can make a true impact on people's lives. Mm-hmm.
Yeah, it just seems so fascinating that, we're such a data-driven society. And you would think that as part of that, going into any medical field, it would be I think in other medical fields, even, we've got this just like overly driven desire to have like every data point we can possibly imagine. So I can only imagine how much great like opportunities are going to come from all the increased data points like you guys are mentioning, because if you understand on both like the genetic side of things, what is playing a factor, and on the social environment in which somebody's living in and all of the social factors that happen because of those demographics. And there's just so much we could still learn and apply to so many different scenarios. And I can only imagine it makes it, it's upsetting we are not there, but it's also very exciting to know that that's the direction that we're all heading, right?
Yeah. And here I can maybe cite our late chair, Sam Gambier. He always said, before a flight, there's a extensive maintenance going on, right? To make sure your plane is okay and everything is running well. But we humans, we just fly through life without any maintenance whatsoever, or very, very little, right? And we only go and get a repair when something broke down. So this is totally not appropriate anymore. We could potentially, based on the data that we have our regular maintenances. We could have a personalized approach for Virginia or any of you, depending on your background and the possibilities of potential problems that might come up in any given person. And with that, we could prevent any problem before we even develop symptoms. And I think that would be sort of like a big picture approach, how we could create much better healthcare than we are doing now. Now it's reactive. It would be much better if we would be much more proactive. Mm-hmm.
This kind of reminds me of the Google project. There's this huge Google project to collect just 1 million data points from a lot of people. But I think it's from like smartwatches or some sort of smart technology that they're acquiring this information. But even there is a limitation because, in the Bay Area, everyone's very tech friendly, tech savvy. They're happy to do that. The more data, the better. But there is, within our country, there is a good amount of people that don't want any of their data out there, much less a device on them. Like there's just that trust hasn't been built there. Like they're convinced it's going to go to the government, or some conspiracy theory is going to be used for some, for space lasers or something. And so that kind of circles back to like, we need to be able to communicate to the public, like, what is this for? What are we not going to do with it either? And that we're trustworthy with their data. And that's also an issue that's coming up with like AI, all the AI technology that's being developed. That requires a lot of data to develop. And we need to, something that I always harp upon in my group is like, we need to be good stewards of that data, make sure we keep it secure. And as technology advances too, there's so much data. My work group, I've been cleaning data for the last 2 years, and we're just now getting to the analysis stage. So I can only imagine the data that we'll have in like 2 years, 5 years, 10 years.
Yeah, and then also when we train computer algorithms, that we are making sure we have like representative data sets for people from different backgrounds, so that it can be applied to different groups of people. Mm-hmm.
Yeah, I was actually going to, as Virginia was describing that, I was going to mention we had a guest, a University of Brown professor who deals with algorithmic bias. So I was even going to like mention like what a great opportunity you guys have to kind of already have the bridge between this data that you're going to collect and this mindset for diversity built in is going to be like, like Virginia said, going to hopefully have some really incredible data that's going to come out of all the work that you guys have already done.
Mm-hmm.
Yeah.
I just think we need to be mindful to make sure the data sets are diverse, or that they're representative, like Heike said, of, whatever population they're going to be applied to.
Right. Yeah. And these conversations are so important because like these biases people can think that they're really being super inclusive, but it's really hard to be completely inclusive unless you really try to consult with people, have a team, and really do your best possible to, make this something that's culturally humble. But I know that there was a little bit in the book about mentorship, and I think this is something that Brendan and I have talked about a lot. And a lot of professors have discussed the importance of mentorship in their journey, kind of throughout their career and their studies. And I'm curious about kind of what your thoughts are about like the impact of mentorship and how diversity in medicine can really influence this.
Yeah, I think mentorship is critically important for everyone, and especially also for people from minority backgrounds. Again, I initially trained in Europe and then came over to the US. And in Europe, or I came from Germany, there's not as much of a barrier with regards to how much money you have. I felt like when I came here, one really major barrier to a good education is that you have enough money to pay for it. In Germany, people sometimes complain if they have to pay a few $100s for their registration at the university, and otherwise most of the education is free, and that then allows everyone who qualifies based on the entrance exams or whatnot to pursue a higher education. And I feel here in the US, that is a much, much, much bigger problem and a big hurdle, especially also for first generation college graduate. So I feel like getting around this financial problem would really help us increasing diversity. When I first came here in 2003, so nearly 20 years ago, there we had almost no paid internships over the summer. This has already changed quite a bit over the last decade. So now many of our internships are paid. And I think that is like one way of getting students into the system and getting some experience or some exposure to the system or to academia, and then so that they can decide if they like it or not. And I think, stipends, supported, financially supported education would be really, really important to get to the first step. I think mentorship overall, there are many, many, many facets to this. I think for people who are underrepresented, it can happen that they face a lot of criticism from the majority group because they somehow are different, and with that they face a lot of criticisms, maybe how they dress, how they speak, how they whatever, how they act, and that can lead to a loss of confidence. And if people are not confident, then they do not take risks. They don't go for like a certain exam or entrance test. They don't try new things. And with that, they may not pursue opportunities that they may be totally capable of doing. So I think addressing this, a limited confidence, as a result of being exposed to microaggressions and constant criticism is really important. Ultimately, that can also lead to the so-called imposter syndrome, that people who are very highly achieving actually doubt their own abilities and then again don't try career opportunities or different, like going from one step in their career to another. I think these are a few things I can think of. Virginia, you might have some other thoughts.
Yeah, I could definitely add on to the mentorship. there is a cultural component, at least in my experience, from like the Latin American point of view. To be a good daughter, a good son, is you have to be very obedient. Just do what you're told, follow teacher's direction, and which is fine. And I did well through that, got me through high school perfectly fine. But then in college, it was a bit of a shock, whereas that's where you really need to be a critical thinker, like as much as possible. And so if you're, with my background, it was very much like, just accept what teacher told you or what this book says. That's completely the opposite of a critical thinker. And so all of a sudden it's trying to play catch up and just trying to be like, what? I can question things. And also, through school and as an adult, I've learned that the squeaky wheel gets the grease. And so if as a student, as an employee, the more you speak up, the more results you have. But again, if you come from a background where it's like you have to obey and just do good and just do what you're told, that's very uncomfortable. And so it's taken me a while to learn, like, no, I need to speak up and really highlight this or talk to this person and be much more assertive and much more proactive in a lot of spaces. And to be honest, like, I've had mentors that help me develop that, because that does not come naturally at all. And having different mentors at different levels also helps a lot too. So definitely having a boss that believes in you, supports in you, is open to answering your questions is super important from a academic work level. But also having other mentors and friends, other women in science, where you can bounce ideas and experiences off with. That is super, super helpful. But I think that is something that if I could go back, I wish I would have cultivated mentors and supporters and cheerleaders a lot more and a lot earlier. So that's something I tell any student I work with, like, go be the squeaky wheel, go find people, find people to bounce these ideas and find advocates to help you out.
Mm-hmm.
Yeah, I resonate a lot with the the critical thinking piece. And I was even thinking back and tying it into the mentor thing. My freshman year of undergrad, I had a professor who taught a philosophy class that was literally just called Think. And that was the whole purpose, was using philosophy to just ask deeper questions. And he was a great professor. And I just really I think a lot of times we've got people who play mentors right in front of us, and maybe we don't register that they're mentoring us in the moment, but we just, maybe in hindsight, we kind of recognize that they played a big significant role in helping develop even just a small particular skill that kind of blossomed into something a lot bigger. Because when I think back to it, all through high school, like you said, I was very much so just it was like memorization, right? And you're just trying to learn the facts, and you don't really get a whole lot of leeway to do a ton of questioning and push back a little bit. And then in university, especially with that class at the very beginning, it was a whole different world was open. And it's very interesting how mentors kind of come up in those places where we least suspect them. And I think that's a great message, is to kind of just be open to constantly cultivating your mentors is something that I think a lot of people would benefit from.
Yeah, for sure.
Yeah. And I think definitely we always also, differentiate mentors and sponsors. So on one hand, you need a mentor who could serve as a role model and can have discussions with you about your career or what might be the next best move. And then you also need a sponsor who sits on the leadership table and speaks up on your behalf when you are not there. And both are very important for a successful career. And one thing that has been also brought up is that people from underrepresented minority backgrounds might not have that sponsor. They might have a mentor, but they might not have that sponsor. And how can we address that? Of course, we can all help by speaking up for talented people. If we are in a position that somehow we sit at a table where decisions are being made, and then, of course, we can also officially cultivate that we make sure every group of people has a sponsor at the leadership table who can advocate for a specific group of people. And it can be students and faculty and staff, or it can be males and females, or like whatever it is. But I think when we create leadership teams, it's also important to have sponsors for these different groups of people on the table, at the table.
Yeah. I'm glad that you brought up the piece about the imposter syndrome. I think it's super easy for like people to just label people based on maybe their performance. And if somebody's feeling inadequate, but they're not, then we just label them as inadequate. And it's really just shutting down all their potential or everything that they can offer. It's damaging.
Yes. So the imposter syndrome is one problem. And then another problem, I do not, maybe you know the word for it. I've always looked for the word which is the opposite of the imposter syndrome. The overconfident person who thinks they know it all and they are on top of the world and nobody else knows it better than them. So we have these kind of people also in our environment, and they are also a problem. So I think it's like both spectrum of the curve. I think it's good to be in the middle, and either extreme can be a problem.
This kind of reminds me of a book that's on my reading list. I haven't read it yet. It's called The Meritocracy Trap. And it talks about how college education has kind of become the biggest divider in American. In the past, of course, we all want to go to college. That's the way up, to higher level societies. But kind of the flip side of that is if someone doesn't go to college, then you think less of them. And I think hopefully that's something that's changing too, because as you said, like finances are such a huge limitation. And also not everyone needs to come from a fancy Ivy League school. Like there are state schools that are provide excellent educations. A lot of times it's a matter of finding the right fit for the right student. And in research too, I think it does need to be broadened out. So it's not just the Harvards, the Stanfords that are directing the research. And oftentimes they're serving a very small population. Like we really need to branch out and partner with the state schools, the schools in Middle America and other countries to really serve a broader population.
Yeah, you bring up a great point too. I think that we oftentimes, as part of that, meritocracy push of got to get a college education, we also push a lot of people into college way before they really know what they want to do. And when you talk about finding a good fit, I mean, most people are going to college out of high school with maybe an idea of what they think that they want to do, but then they're navigating and trying to because it's probably not a good fit, or they're dropping out because they don't really feel motivated to do it anymore. And I think that's something that I hope is changing. I think there's a lot of people who are getting advanced degrees after they've begun a career too, that I think will help motivate this. But I really think we just need to put a premium on really knowing what your intent going into college is going to be. I think if we did that, we would open up the motivation for somebody who maybe didn't go right out of high school, but is full of knowledge and curiosity, and then comes across something, not going it's too expensive and I'm already so far behind, I could never do it. Yeah. I think that it just cripples so many people, and it's terrible. I mean, yeah, I went back to school 4 years after graduating and working for a while. And I think, for my career, it really helped align me to an area where I feel like I've got a much more focused career effort. And I think that's, helped me out tremendously. But I don't feel like a lot of people have that push.
Yeah, I kind of feel like you have your one shot straight out of high school. And if you don't choose right, and when you're 18, 19, it could really set you back. Even if you do go go back, because I went to school too as an adult. My family jokes that I'm a perpetual student. So I'm a professional student. But it's expensive. Like I for sure have student loans, and it took me a while and a couple of jobs to really like hone in that what field I work in, want to work in, home skills that, I feel confident in. And I think of other people whose families aren't that supportive and they don't have that opportunity. Like what talent are we missing out there too? So hopefully that changes. I don't know what it would take, apart from like student loan forgiveness or more scholarships for adult students or second-time students. Definitely more support for PhD programs, because a lot of times someone may want to do a PhD program, but the cost of foregoing a salary is not an option. And a PhD stipend might cover the food and housing, but it doesn't help with family costs or paying already existing student loans. So a lot of things to consider.
Well, one thing that I noticed coming from Europe is that here in the US, it's so important to have a CV that has no gap at all. Like if there's a gap, that's always a bad thing. And it always needs to be found out what happened there. Mm-hmm. And I think in Europe, we have a more flexible culture there. People take time off in order to travel around the country, or somebody takes a family leave for a really long time. And I felt like there was much more flexibility of the system to accept that for one reason or another, people may take a gap in their career path and then continue later on. And it's nothing negative. It's just something that happened in their lives. And I feel that flexibility is not as much present here. It has to be one step, next step, next step, next step. And you cannot possibly have a gap. And there I would really want to challenge that and say, like, why not? It could actually be enriching for that person.
Mm-hmm. Yeah, the key word being flexibility. I was thinking about this today, actually, this morning, of like how much of an influence we put on resumes and CVs, mm-hmm. and how it's like really defining people and their trajectories. And it's really sad because I remember growing up having like different counselors or different people around me who were supporting me and trying to help me, but they would tell me like, oh, you don't want to add this to your CV, or you don't want to put that experience. Like these employers don't care about that. And I'm just like, oh man, like that, like you're trying to confine me to a certain box. And maybe that experience was super empowering and was something that was very transformative for who I am today. Mm-hmm. And it's just a shame that, we put these labels on people and maybe don't see them for everything that they are, but just, some fancier words on a piece of paper.
I think in science too, people think of math and science as like there's a final answer at the end, and there really is a lot of room for creativity and playing around. And there's a joke that research means redoing something over and over and over again, because a lot of times you don't get the result you expect or want in the beginning. So there has to, I think we definitely need to have a more open mind. Like we don't, having someone that finds the right answer or the first time may not really be the best thing. Like we need someone who's resilient, who knows how to rethink and re-strategize when something fails. And that kind of happens in life too. But a lot of times in science and research, there's a lot of pressure. Like I have to design the study perfectly. So even if it doesn't work out, I still have an answer, or I can still get funding. So I think there's a lot more room for creativity there, and understanding and openness.
Yeah. Yeah. And so I also just kind of wanted to ask, I know that within the book, there were several lists at the beginning of each chapter talking about some things that you thought a lot of the readers could take away and do for themselves to start to be an ally. But I'm curious about both of your perspectives on like, what are some things that you'd really like to hit home about being an ally and promoting diversity in medicine?
Mm-hmm. I think, yeah, as you mentioned, there are many things that can be done also, like for different communities and different aspects of diversity. In our books that you mentioned, we actually discussed that with our diversity committee, and I also regularly offer meetings for all people in the department and minority members in particular to just meet and discuss if some problems comes up. And based on that, I made a note of different take-home points. And so that led to these lists in the book. And I cannot possibly list them all here, but I think one general theme is to maybe first start to educate yourself on a certain topic. And again, there are different aspects of diversity. It can be gender related or disability related or first generation scholars problems or racial equity. So there can be different aspects to this. And whatever it is, I think I would always first start to educate myself. And there are lots of resources on the web that would be available. I think anybody can just maybe start Googling and then make their way from there. I think it's important to listen specifically to people who are underrepresented in our communities. Ask them actively to share their ideas. They may be reluctant to do so. And perhaps starting a conversation and actively asking them, what do you think? We have this problem. How would you solve this problem? Or what do you think about our environment? Do you think there are areas of opportunities? Really open questions so that people who come from a slightly different background than any of us, that we can learn from their experience and really listen and expand our horizon that way. On the other hand, I think it's actually very popular to do listening tours. So one person goes out there and listens to a lot of people and then draws conclusion that in one way is good. On another way, there's of course a lot of bias involved in that. There may be selective hearing. There could be somebody perceived of stealing ideas. I heard that comment. Somebody goes around and asks for ideas, and then they claim that as their own idea. So I think if somebody goes on listening to us, it's really important to establish with the people whether they want to be mentioned together with their idea and acknowledged as the originator of the idea. I think we really, with regards to minority members, I think the biggest help perhaps would be the majority of people, because they have the power to change things and to speak up and to raise awareness. So if anybody out there is a member of the majority group, I think it would be really important that these people listen actively, and if they see something that doesn't seem to be right, speak up and be a partner in order to create a better community for all of us. I think these are a few take-home points. Mm-hmm.
Yeah, I would kind of support a lot of those, on an everyday work level. Sometimes people will say little jokes or little jabs they're actually like well-meaning, and they mean as a joke, but may not really be supportive of diversity members. And I think it's super important that allies, nicely also be like, hey, that's not really cool. And be, kind of stand up for us as opposed to just laughing it off. Get to know people that aren't like you. And as a minority, sometimes that's hard for us to do too. So it definitely goes both ways. And I think we could, definitely learn and grow from people that aren't like us. On a broader level, the leaky pipeline into radiology and medical imaging starts way before college. So anything we can do to support STEM programs, telling kids that science and engineering and all these hard subjects, that they're not, they may be hard, but they're not impossible, and that, failing, we're not doing well. That's part of the process. You just have to pick up and keep trying, and you'll get there. And it's super rewarding to do that as well. In college and graduate programs, definitely need more resources to support minorities to stay on those paths. And then medical school, I think leaders are being more mindful of recruiting diverse candidates. They're not just looking at the resumes and the straight A students, that I think they are starting to listen to individual stories and weigh non-traditional experiences a bit more. And I think overall that'll help the whole system as a whole.
Mm-hmm. One thing that I would maybe also like to add is when I first came to the US, I remember one thing that somebody said to me. I noticed something and said, "This is not fair." And then my colleague said, "Grow up, life is not fair." So as they perceived it a little naive, or as if I was acting as a child, to request that a situation should be fair. And I would want to challenge that notion. I think that life should be fair. And I think it's up to all of us to create a fair environment. And that would not only be the right thing to do, but it would also overall in our communities improve the morale and productivity of our teams. So I would say we should all work together to create fair environments for all of us.
Yeah, thank you.
Yeah. And this is a topic that came up in my training for clinical psychology that I think is pretty important, and I think can be easily understated or almost misunderstood. But I was wondering if you two could speak about like cultural humility versus cultural competence and some of your perspectives on that, and maybe the differences and why it's important.
Mm-hmm.
I can start if you. I think that's actually like a really nuanced question. It's a wonderful question. I think cultural competence. I think it might be really easy to kind of read a little bit about something, culture, and then think you're like, oh, I got this. Whereas opposed cultural humility, I think is much more kind of leaves the door open for whatever may happen. I don't know. I think one of the greatest gifts that I've gotten as a Bay Area native is that I really kind of approach everyone with an open slate, regardless of who they are, because you never know. Like the person walking around without shoes could be a co-founder of an amazing company, and they look like a homeless person. So I've always been very wary of labeling people because people surprise you. And then in the opposite direction too, like just because someone is super polished and has a fancy resume, that's not always indicative that they know everything. And I definitely, as a minority, as a person of color, I definitely appreciate when someone is curious about my culture. And when they're asking questions about my background, about my family. And I think I know lately people are maybe a little hesitant to ask, I've gotten the question of whether asking where I'm from, is that offensive? And like, it can be if you sense some sort of hesitation with it. But when I think it comes through when someone's actually genuinely interested and curious, and that just, helps open the door for more conversations and learn things. But I always tell people, you never know what to expect from someone, especially in the Bay Area, but that should apply everywhere. Like, don't label people before you get to know them.
Mm-hmm. Yeah, I'm still learning with regards to cultural competence and cultural humility. So one take that I have on this, but it's a very complex topic. Cultural competence is very much about I try to understand the other, another culture that is not my culture. And cultural humility is more in integrating self-reflections to understand my interaction with that culture. How do I react to that culture, and how can I successfully integrate with that culture? I think that's a little bit along those ways. But like finding concrete examples to this is a little difficult. That's more of a like general concept. I think being humble about own privilege, understanding that I may not know things and I'm not aware of what I do not know, and trying really to integrate and not only understand one culture, but also how my position relates to that culture might go a little bit in that direction.
Mm-hmm. I guess I can give a good example of how I think this kind of plays out in real life. Like, like if someone automatically starts speaking Spanish to me, there's a lot of unspoken cues, but there is definitely a big difference when it's someone who's speaking Spanish to me because they think I can't speak English, as opposed to someone who actually like somehow kind of like knows my culture, and then it becomes like, oh yeah, like there's a connection point there. Like one is building connection and the other one is like closing connection, and you're making inferences about me that aren't true. So I think like that's just like the most blatant example I can think of you know, cultural competence when it can go wrong versus cultural humility.
Yeah, and I think that's also maybe where this might connect to what you mentioned earlier, Virginia, when you get this question, where are you coming from?
Yeah,
I think it can be genuine interest, right? That just somebody is interested. So where are you coming from? And you want to start a conversation based on that because you notice, based on the accent or something, they are not from here and you just want to learn about them. And I think that's entirely fine. That's how humans connect. I think that could be a first question. I think where it becomes problematic is when somebody questions your right to be in a certain place. It's rather, where are you coming from? You are not from here. You do not belong here. And it can get worse that they say, go back to wherever you are coming from. And then somebody says like, oh, this is the longest I've ever been in any place. What do you mean? Where should I go back? And so I think it depends very much on the context.
Yeah, I like to think, you know, without knowing too much of the depth of the definitions, but I like to think of the competence as like an aspiration and the humility as more of a daily practice.
Yeah,
right.
That's a good one. Yeah.
Yeah. Yeah. And I think that's what, like in the training that we had around this topic, that's what was really mentioned was, the word competence kind of like rubbed me the wrong way in thinking about something like this. And so I'm glad that it is kind of identified as, you know, just like really trying to educate yourself, having knowledge about this, but then also supplementing it with like, you need to go into this knowing that you don't know everything. Like staying humble in this experience is going to not only support yourself, but it's going to support the other person. And I think that's what I love just about this work and this conversation today is that like at its core, it's about promoting everybody to be the best person that they can be, to promote the best research that there can be so that we can have the best care that we can have. And it's a shame because this is something that seems it's so simple, like so fundamental that it should be there. But like we've talked about today, there's so many layers to this that are at play and so many factors. And without these conversations, it's easily swept under the rug. Yeah.
Well, thank you guys for hosting this conversation. I think there are lots of people that are like curious about it. And I think having more conversations like this helps give people like just the vocabulary to actually be able to engage and start conversations. So I really appreciate it.
Yeah, I also thought this was really a great conversation. Oh
yeah, thank you both so much. We really appreciate the time, and we look forward to continuing to stay connected and follow the work that you do.
Sounds great.
Thank you so much.
Thank you.